Chief and Director of Cancer Screening and Survivorship at Roswell Park Comprehensive Cancer Center in Buffalo, New York. So the technical definition by the National Cancer Institute is that as soon as someone is diagnosed, they essentially become a survivor. And it's true because there's a set of issues that are happening to them on multiple levels the minute you get diagnosed. Operationally, we really consider survivors as people who finish treatment. And part of that definition is that at that point, we feel like that is the moment where they can start to rehabilitate and recover from cancer treatment and identify those sequelae that are going to be ongoing, what their additional needs are, and then begin the process of recovery and getting back to wellness and health. Of all the specialties that primary care physicians refer their patients to, the one specialty where they really lose contact with their patient is oncology. And a part of that is because it's really different. It changes all the time. The patient has an intensive treatment schedule. They go through a lot, they change a lot. And that sort of adds to some issues when survivorship starts, in that we really need this reintroduction back to the primary care physician. You know, when you finish cancer treatment, managing your diabetes and your blood pressure and your COPD and all the other kind of chronic diseases typically managed in primary care become bigger issues. Part of that, identifying what survivors need, is a big part of that is to acquaint themselves with their primary care physician. There's many initiatives at the national level, and I think this is happening locally, especially with places like Roswell Park, where we're improving the communication between oncology and primary care. Oncologists don't want to treat chronic primary care issues, and primary care physicians are often unacquainted or unfamiliar with the current literature about what the sequelae mean. The best tool, it's kind of gotten mixed reviews, but I think now we're moving forward, is a care plan, which should come from the oncology team, and in our case, from our survivorship clinic specifically. We're kind of the interim between oncology and primary care, which outlines all of the treatment, all the possible side effects related to those specific drugs or that specific modality that both the patient and the primary care should be aware of. Again, peripheral neuropathy, again, cardiac signs, again, long-term intestinal issues. And that tool can provide both the patient and the primary care to say, hey, you know, this is what might happen to me in the future. So if I have symptoms that need to be resolved, I know I can go to my oncologist or I can go to a cardiologist. But just this communication, because it's really important that if the cancer recurs, obviously come back to oncology. But if there are symptoms that can be managed out in the community, that's much better for the patient. But you know, again, it's partly education and partly communication that has to happen between these two disciplines. At Roswell, patients have sort of an interim step between oncology and primary care, which is survivorship. We have a special clinic actually run by Dr. Tisa Flores, who's a primary care physician, because we want all of those issues to be really well articulated before the patient starts to transition back to the primary care. Oftentimes they already have, and now we just want to provide that extra bit of communication. So that really needs to happen on oncology side, because we know what happened to the patient. Our physicians, our oncologists read the literature on all the long-term side effects. And so it really starts here. Every patient who's kind of graduating from care is supposed to get a care plan. In our case, it happens in our survivorship clinic because, again, we are very much aware of the support services in the community that maybe they can access. And we want to make sure that we're articulating what may happen to the patient in ways that make sense to the primary care community.